Joining me now are Rockefeller Foundation President Dr. Rajiv Shah, former administrator of USAID, who helped lead the Ebola response in West Africa, and Dr. Amish Adalja, senior scholar at the Johns Hopkins Center for Health Security. Raj, to you first, let's talk about your proposal, the components, and how you see $75 billion. Would this be federal money? How do you expect this to be spent?
Well, Andrea, we do have an opportunity right now to make a national investment to avert a real disaster this fall. As you point out, we're doing 4.5 million tests a week right now. We have been saying since April that we need to hit 30 million tests a week by around the time the next flu season starts. And that's going to be late September, early October. We can get there. And the only reason we can get there is there are new antigen tests that have been proven to be sensitive enough, much lower cost, and provide a turnaround time of maybe 20, 30 minutes, which would allow for large scale screening. So schools could be open and teachers could feel safe, and other critical institutions can use these tests to screen those without symptoms. But it'll only happen if we make a major national investment of $75 billion and get enough product on the market quickly. And the federal government certainly has the authorities to do that through the Defense Production Act, through BARDA and the advanced purchase commitments they could make, as well as states.
Dr. Adalja, one of the problems, of course, is the lag time, and these antigen tests have a quicker turnaround. But right now, with the testing that is being available, just today, the Washington Post is reporting that in D.C., the lag time is 2 weeks, which is basically useless.
Yeah, it is completely useless when you have a test result that takes longer than the actual duration of the illness for many people. You have to think contact tracing is often keyed on a positive test. If that test result is lagged, all of the contact tracing is going to be flawed. And there are many people who can't afford to stay home for that many days waiting for a test result. So this really is not a way to manage an infectious disease emergency. We have to be able to get tests just the way we can get an HIV test. And it is going to be very difficult during the flu season, as Dr. Shah alluded to, when you have to deal with, does this patient have COVID or do they have influenza? And you need to know that quickly because there's different treatment pathways. So we're not going to be ready for the flu season unless we have testing scaled up using rapid antigen tests if they are available.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.